Massachusetts is ranked among the best states in the country for healthcare, but it also ranks third for longest emergency room wait times.
Boston.com recently posted this video with an accompanying article, and I want to start by saying I do think it is extremely important to discuss this topic. But working in an emergency room, I have to say that the way it was presented really struck a chord. The article is presented as a series of patient complaints that are essentially unverified, which is not to say that they are not valid, but they are lacking any context about why that patient may have been waiting, and any discussion about all of the fundamental root causes that make emergency room wait times such a problem across the United States and certainly within Massachusetts. So let's start with the data that they quote right up top, that Massachusetts has an average emergency room length of stay of 189 minutes. 189 minutes sounds a lot worse than 3 hours, right? But 3 hours to get a comprehensive workup that includes oftentimes labs, imaging, sometimes seeing specialists, is not that unreasonable a time frame in the context of the healthcare system that we are faced with currently. The article goes on to talk about other notes that they've gotten from readers about things like being sent in by their primary care doctor for an emergent result, but then not being seen in a timely fashion, about how terrible it is to wait to be seen in the hallway of an emergency room. And the thing is, I and most people who work in an emergency room agree with those frustrations. What the article doesn't touch on so much is the number of patients who are in the emergency room because lack of availability to be seen by a primary care provider, because they don't have the insurance coverage to be seen by an outpatient provider, or the fact that Massachusetts has had several hospital closures over the last several years. So do I feel that the way patients are having to wait in the emergency room and some of the care that they are getting is unacceptable? 100%. We are on the same page about that. However, unfortunately, when an article is presented in this way, my lived experience is that it seems to result in patients having a lack of trust in the medical system and appropriate frustrations directed at people who actually have nothing to do with the reason why these things are happening. I think it's incredibly important for the public to understand that emergency rooms across the country have become the safety net to try and cover the gaps within our healthcare system as a whole, and for the most part that the physicians and nurses and staff that are working in these emergency rooms care deeply for the patients and feel the strain of these limitations almost as acutely as they do. I sent an email to that journalist, and she wrote back to me so thoughtfully and respectfully and was completely open to continuing this conversation in a way that provides a little bit more context for the general public to understand the full scope of this huge issue. Stay tuned.